Now coming to the superior wall. The superior wall is formed by the continuation of the tegmen antry that is seen while you are drilling over the area of mastoid, right? And this tegmen antry continues to form the tegmen tympani, and it is separating it from the dura of the temporal lobe. Okay, dura of the temporal lobe. This tegmen tympani separates the midlayer from the dura of the temporal lobe, and of course from the tegmen tympani you have got a projection called cope which divides the epitympanum into anterior and posterior epitympanum, and also it forms a landmark for the first journey of the facial nerve. All these things you know, right? So this is how the dura of the temporal lobe is being separated from the midlayer by the tegmen tympani. Now this is the real life picture that you can see. The imagination of the six-sided box can serve only in the purpose for learning. Okay, in reality this is kind of like how you see when you look at the midlayer cavity. Okay, as you can see here, there is the lateral semicircular canal and the seventh nerve. They are seen on the medial wall and the posterior wall, and here you have the tympanic membrane, and this is the chorda tympani nerve passing between the handle of malleus and the long process of Ingus, and you can see how the tensor tympani muscle is getting attached to the hand of malleus, and here you can see from the pyramid the stapedius tendon is getting attached to the stapes. Okay, this is the tympanic plexus over the promontory. Okay, so this is the endoscopic picture of the medial wall of the midlayer. Sometimes such pictures can be kept for your exam. And what are the structures that you see here? This PR is of course the promontory, and from the promontory I told you there are two projections, right? One towards the pyramidal eminence and the other towards the round window area. So this first one is the porticulus and the second one is the subiculum, and the area between is what is called the sinus tympani. And here you can see how the facial nerve is extending downwards like this, the vertical part of facial nerve. And this is the oval window, and here you have the round window. This is the stapes. Okay, stapes, head of stapes. This is the stapedius tendon going to attach to the dichostapes. Okay, sometimes such endoscopic pictures can also be kept for your exam. Okay, now you can see how the short process of Ingus being kept in the fossa ingudis. Okay, fossa ingudis. Right, this is another picture which is seen after removal of the outer attic wall as well as the tympanomeatal flap. Okay, now chorda tympani passes between which layers of tympanic membrane? Is it between the outer and middle and inner, epithelial, none of the above? You will learn that the chorda tympani passes between the middle fibrous and the inner mucosal layer, right? So the answer is B, middle fibrous and inner mucosal layer. Okay, now coming to the structures within the midlayer cavity. What are the structures within the midlayer cavity? It is mainly air which is seen within the midlayer cavity, and you have got the various midlayer spaces, and these spaces are formed by the, I already told you this midlayer cavity is being formed by the tubotympanic recess, and from the tubotympanic recess develops the various saccus, the various sacs called the saccus indicus, saccus medius, saccus posticus and saccus superioris. Okay, so they contribute to the development of the various structures in the midlayer, that is the epitympanum, mesotympanum, and I'll be coming to it soon. Before that, we have to know about the various structures which help in the hearing. And what are these structures? They are the ossicles. Okay, the first ossicle that you have to learn is the malleus. Okay, malleus. Now the word meaning of malleus is hammer. Okay, malleus is the Greek word for hammer because it resembles a hammer because it is having a head and a manubrium, right? You can see how it resembles a hammer. And ingus word meaning is anvil. This is a picture showing a hammer kept on an anvil. It is called so because it resembles an anvil. Okay, ingus is called so because it resembles an anvil, and this malleus resembles a hammer. And this malleus has got a head, a neck, a manubrium. It has got a facet for ingus, a lateral process and an anterior process as well. Okay, it has got a lateral process and an anterior process, and on the anterior process is attached the anterior malleolar ligament which passes through the Glaserian fissure. Okay, I already told you about Glaserian fissure through which passes the anterior malleolar ligament. Okay, now coming to the anatomy of ingus, I already told you ingus is shaped like anvil, and so it got its name ingus. Okay, it is a Greek word for anvil, and this ingus consists of a head, a long process, a lenticular process, and a short process. And it is this short process which is seen in the area of fossa incudis, which forms a boundary of facial recess, right? All these things which you have already learned, right? And this is the articulation with malleus, and here you will have the head of malleus, right? So the head of malleus will be seen here, and here you have the handle of malleus. Okay, so this is the area where it is attached to the head of stapes, right? And from the head of stapes comes the neck, and then the crura, and then the footplate of stapes. Okay, so this is how it appears. And so there are two joints here, right? Here between the malleus and the ingus you have one joint, and between the ingus and stapes another joint, right? These both are synovial joints because there is movement happening here, and this joint between the malleus and ingus is a saddle joint, and this is a ball and socket joint. Okay, this is a ball and socket joint. So you can see here the malleus and ingus forms a saddle joint. Okay, saddle joint, and ingus and stapes forms a ball and socket joint. Okay, this is a very important question because it is asked as an MCQ multiple times. Okay, so what is the word meaning of stapes? Stapes means stirrup. Stirrup is actually the footboard. Okay, footboard. While you are riding a horse, you need a footboard, right? And it is shaped like that, and hence it got its name stapes. Okay, now the stapes has got a head, neck, a crura, anterior and posterior crura, and a foot plate, and this foot plate is attached to the oval window, right? So these are the parts of a stapes, and to the stapes neck is attached the stapedius tendon. Okay, now coming to the various spaces within the mid layer. On the mid layer, broadly you can divide it into epitymmanum, mesotymmanum and hypotymmanum, but actually there are 5 spaces including the retrotymmanum and the protymmanum. The area around the eustachian tube is what is called the protymmanum, and the area behind the mesotymmanum is the area of retrotymmanum, where you can see the facial recess and sinus tympani. Okay, now how is this epitymmanum and mesotymmanum divided? Mesotymmanum are having the boundaries over the upper and lower part of the pars tensa of the tympanic membrane. Okay, above the pars tensa of the tympanic membrane you have the epitymmanum, and below the pars tensa you have the hypotymmanum. Now from this picture itself you might get it clear on which is the largest part of the mid layer cavity, right? You might think this is the mesotympanum. No, but that is not the answer. Actually, it is the epitympanum, which is the most largest part of the midline cavity. You have to look at this picture. Okay, from this picture you can get it in a better manner. Here the diameter is only 2 millimeter. Okay, so it is having the shortest diameter. The largest area is seen in the area of the epitympanum. Okay, it is the widest part, and hypotympanum is the smallest area. Smallest area and volume is seen in the hypotympanum. Okay, epitympanum is having the widest area as well as the largest volume. Mesotympanum is having the narrowest area. It is 2 millimeter. Here it is 4 millimeter, and here it is 6 millimeter. Okay, so that's about the various spaces of the mid layer. Okay, now you have learned that the epitympanum is the space which is seen above the mesotympanum, right? And this epitympanum is seen if you are removing the scutum or the outer attic wall. Okay, and on the epitympanum you can see the head of malleus and the short process of fingers as well as the body of the fingers. All these are seen within the epitympanum. Now, how is this epitympanum getting ventilated? We already know that it is the mesotympanum that is getting ventilation through the protympanum via the eustachian tube, right? And so how is this ventilation going into the epitympanum? It is going through openings within the tympanic diaphragm. Okay, what is this tympanic diaphragm? Tympanic diaphragm separates the epitympanum from the mesotympanum. Okay, it is a diaphragm which separates the epitympanum from the mesotympanum. Okay, and on the tympanic diaphragm there are two openings, the anterior tympanic isthmus and the posterior tympanic isthmus, and through these openings the epitympanum is getting ventilated. Okay, and how the mesotympanum is getting ventilated? It is through the pharyngotympanic tube or the eustachian tube. Okay, eustachian tube. So just like this, the epitympanum is seen as an attic. Okay, attic is a storage space in the upper part of the room, right? Similarly, you have an epitympanum in the mid layer, and this area is getting ventilated from the mesotympanum through the anterior and posterior tympanic isthmus. Okay, now there is a space in the area of the epitympanum, and this forms the lower unit of the epitympanum. Okay, and this lower unit, which is very important in terms of learning cholesteatoma, this space you have to be thorough with. Okay, this space is what is called as the Prusac space. Now, where is this Prusac space seen? This Prusac space is seen in this area. This part is what is called the Prusac space, and this Prusac space is bounded superiorly by the lateral malleolar fold. This is the lateral malleolar fold. Okay, superiorly you have the lateral malleolar fold, inferiorly you have the lateral malleolar process. Okay, the floor is formed by the neck. This is the neck of malleus, right? So this is forming the floor. Okay, and laterally you have the pars flaccida as well as the outer attic wall or the scutum. Okay, so this space is bounded laterally by the outer attic wall or the scutum and the pars flaccida. In the floor you have the neck of malleus. The neck of malleus is also forming part of the medial wall, and also you have the lateral malleolar fold forming the superior wall, and the lateral process of malleus forms the inferior part. Okay, so these are the various parts of the Prusac space. Now coming to the blood supply of the mid layer. Okay, now what are the arteries supplying the mid layer? From this picture itself is clear that you have got blood supply coming from the internal carotid artery, right? Okay, internal carotid arteries, caroticotympanic branches are supplying the mid layer, but is it this branches of internal carotid artery alone? No, branches from the external carotid artery are also going into the middle ear. Which branches? The stylomastoid branch of posterior auricular artery, then from the anterior tympanic arteries branch, which is a branch of maxillary artery, and from the middle meningeal arteries deep auricular branches. Okay, all these blood supply go into the middle ear and they form an anastomos with the carotico-tympanic artery branches from the internal carotid artery and then supply the middle ear. Okay, so that's about the blood supply of middle ear cleft. Now, what is the nerve supply of the middle ear cleft? The tympanic branch of glossopharyngeal nerve is supplying the medial surface of the tympanic membrane. Okay, the lateral surface of tympanic membrane is being supplied by the auriculotemporal nerve anteriorly and the auricular branch of vagus posteriorly. Okay, the medial surface of the tympanic membrane is being supplied by the tympanic branch of glossopharyngeal nerve. It is in fact supplying the whole of the middle ear. Okay, so these are the various things that you have to learn in the anatomy of the middle ear cleft. Now, what are the things that we learned today? We have learned that middle ear cleft includes not just the middle ear but also the eustachian tube as well as the mastoid aerosol system, right? And this middle ear cleft develops from the tubotympanic recess, and we learned how the saccus anticus, posticus, medius and superioris, all they form the various parts of the middle ear cavity such as the epitympanum, mesotympanum, hypotympanum, and not just that, they are also contributing to the formation of the mastoid aerosol system, right? All these things we learned how the temporal bone is initially formed from the branchial arches mesenchyme and where it undergoes the pneumatization from the tubotympanic recess, the dorsal part of the tubotympanic recess where you have the saccules which pneumatizes into this temporal bone to form the mastoid aerosol system. And we learned about how the persistence of the septum leads to incomplete clearance, and that septum is what is known as the corner septum. And what else did we learn today? We learned in detail about the anatomy of the eustachian tube and how the adult eustachian tube is differing from the infant eustachian tube, and we learned about the middle ear, the various walls of the middle ear and various structure within it, right? And then we went on to learn about the various contents of the middle ear such as the ear ossicles. And then what else did we learn today? We learned about the mastoid aerosol system, and then we learned about the approaches through the mastoid such as the facial recess approach or the posterior tympanotomy approach between the facial nerve and the chorda tympani so as to insert the cochlear implant. And what else did we learn? We learned that through the mastoid we also can access the posterior cranial fossa through the Trotman's triangle, right? Trotman's triangle is the area through which you can access the posterior cranial fossa. Then you learned about the Donaldson's line with the help of which you can access the endolymphatic sac for its decompression in Meniere's disease, right? So we have learned a lot of things today. So you please go and read today itself and make sure that you revise these chapters again and again so that you don't forget for your upcoming theory exams or while you are going for your entrance exams later on. Even then it will be very helpful if you are learning these things in a systematic manner. Okay, if you are learning systematically and revising properly, you will never forget a lot of things. Some things you might have forgotten when you are going for your entrance preparation, but you will be able to recollect it soon after you read it. Okay, so it's important that you keep track of yourself and make sure that you learn things in a systematic manner, and of course revise the topics that you have already learned. Okay, now that's all for anatomy of middle ear cleft today. Thank you.